Welcome back to our flatworm series. Hi, I'm Christopher. We have already built the cestode pattern. Adult here, larval stage there, and exposure explains the bridge. Echinococcus is where the pattern becomes especially important. Even the name offers a clue. Echino refers to something spiny, while coccus refers to berry or grain. The adult is a tiny grain-sized tapeworm with a hooked scolex. Yet its larval stage can cause major disease in animals and people. We will compare two major zoonotic patterns. Echinococcus granulosus, the dog-sheep cycle associated with cystic echinococcosis or hydatid disease, and Echinococcus multilocularis, the fox rodent cycle associated with alveolar echinococcosis. Tiny adult, giant consequence. Start with the big rule. For the species emphasized here, the adult usually lives in the small intestine of a canid. It measures only a few millimeters and just has a handful of proglottids. Eggs pass in the feces and are immediately infected. An intermediate host ingests those eggs, the oncosphere hatches, penetrates the intestines, migrates, and develops into a tissue metacestode. The adult and the canid is usually not the dramatic clinical event. The major disease occurs in the intermediate or accidental host. So imagine a tiny adult in a canid and a much larger tissue problem somewhere else. First, Echinococcus granulosus, the classic dog-sheep pattern. Dogs and other canids are definitive hosts. Adult tapeworms live in the small intestine and eggs pass in the feces. Sheep and other livestock or ungulates are common intermediate hosts. They ingest eggs from contaminated pasture, feed, water, or soil, and larval cysts develop, especially in the liver and lungs. The cycle closes when a dog eats raw infected viscera or offal containing viable protoscolices. Humans enter accidentally by ingesting eggs from contaminated hands, food, water, soil, or other environmental material. Now zoom in on cystic echinococcosis, also called hydatid disease. Hydatid comes from a Greek term associated with a watery vesicle, which fits this fluid-filled lesion. Common sites include the liver and lungs. Cysts are usually well circumscribed, slow-growing, and persistent. As they enlarge, they create mass effects and impair organ function. Leakage or rupture may trigger severe hypersensitivity and release viable protoscolices that seed secondary cysts. A host-derived pericyst surrounds the parasite-derived laminated and germinal layers. The germinal layer produces brood capsules, daughter cells, and protoscolices. Those protoscolices are future tapeworm heads waiting for a definitive host to eat infected tissue. Biologically elegant and, frankly, rude. E. granulosus does not impress us with a large adult. It impresses us with a fluid-filled larval factory. Now compare Echinococcus multilocularis. The classic natural pattern is fox or wild canid plus rodent. Foxes are important definitive hosts, and dogs also carry intestinal adults. Small rodents, such as voles and mice, are the usual intermediate hosts. Rodents ingest eggs while foraging, and the larval stage develops primarily in the liver. A fox or dog then eats the infected rodent, allowing adults to develop in the small intestine. Humans become accidental intermediate hosts, ingesting eggs from contaminated soil, food, water, hands, or potentially a fecal contaminated canid coat. The route is fecal-oral ingestion of eggs, not simply being near a fox or petting a dog. Multilocularis means many little compartments, a useful clue to this multivesicular lesion. Alveolar echinococcosis is the invasive pattern. Alveoli are little spaces, and the lesion grows as numerous small vesicles in a honeycomb-like mass. Unlike the well-circumscribed hydatid cyst, E. multilocularis grows with poorly defined margins, infiltrates liver parenchyma, destroys normal architecture, and may extend beyond the liver. Its behavior resembles malignancy. Dogs deserve an additional note. They may carry intestinal adults as definitive hosts, but after ingesting eggs, they may also become aberrant intermediate hosts and develop severe hepatic alveolar echinococcosis. Same parasite, different life cycle position, very different consequence. Granulosus builds an expansile cyst. Multilocularis infiltrates, like a bad tenant who discovers there are no locks inside the building. Here is the comparison to keep in your head. Echinococcus granulosus follows the dog livestock pattern and causes cystic echinococcosis. Think well-circumscribed, fluid-filled, and expansile with brood capsules or daughter cysts possible. Severity depends on the organ, lesion size, rupture, and complications. Echinococcus multilocularis follows the fox rodent pattern and causes alveolar echinococcosis. Think multifascicular, honeycomb-like, poorly defined and infiltrative with no single enclosing cyst wall. Disease may be progressive and fatal if untreated. Both release immediately infective eggs, and both can cause tissue disease in people. Remember the canine exception. Dogs exposed to E. multilocularis eggs may also develop invasive tissue disease. Granulosus equals cystic and expansion. Multilocularis equals alveolar and infiltrates. Now for a diagnostic reality check. Match the test not only to the host, but to the role that the host is playing. When a dog is acting as the definitive host, adult worms live in the intestine. Diagnosis can be difficult because the adults are tiny, proglottids are rarely seen, and the relatively dense eggs may be missed on routine flotation. A negative fecal examination, therefore, does not exclude intestinal infection. When eggs are found, they look like other taenia eggs, thick-shelled, radially striated, and containing a hexacanth embryo. Routine microscopy cannot reliably separate Echinococcus from taenia. The egg has arrived without a species name tag. Because Echinococcus eggs are immediately infective, suspected fecal material requires careful handling. Species-specific testing, such as PCR, may identify an intestinal infection. But the diagnostic approach completely changes when a dog is acting as an aberrant intermediate host. In canine alveolar echinococcosis, the metacestode is growing within the liver and other tissues. That tissue infection does not produce eggs in the feces. Thus, fecal testing cannot diagnose the hepatic disease. A positive fecal test would indicate a concurrent intestinal infection but not identify the liver lesion. Tissue stage disease may progress quietly until imaging reveals an infiltrative hepatic mass or clinical disease becomes advanced. Diagnosis relies on the lesion pattern, imaging, histopathology, and molecular testing of tissue, with serology sometimes providing additional support. Routine blood work may point the clinician in the direction of hepatic imaging. So begin with the host's role. Intestinal adult infection points towards fecal testing. Tissue stage disease points towards imaging and the lesion itself. Same parasite, different stage, entirely different diagnostic window. Prevention follows life cycle. Control means breaking the bridge between canids and intermediate hosts. For the dog livestock pattern, prevent access to raw offal, carcasses, and infected viscera. Use proper slaughter and offal disposal, and apply strategic praziquantel-based deworming to at-risk dogs where recommended. Treatment removes adults, but does not prevent reinfection. For E. multilocularis, reduce rodent attractants and discourage hunting, predation, and scavenging, especially in endemic areas. Environmental control means preventing contamination, not assuming routine sanitation will destroy the eggs. Promptly remove feces, dispose of them safely, and protect feed, water, pastures, gardens, and food growing areas. Hand hygiene and washing potentially contaminated produce protect people as well as animals. This is a true One Health parasite. No bridge, no cycle. Break the bridge, protect everyone. Let's summarize. The shared pattern is a tiny adult in a canid, immediately infective eggs and feces, ingestion by an intermediate or accidental host, and larval disease in tissues. E. granulosus means dog livestock cycle and cystic echinococcosis, usually a well-circumscribed, fluid-filled expansile lesion. E. multilocularis means the fox rodent cycle and alveolar echinococcosis, a multivesicular, infiltrative, and usually liver-centered lesion. Dogs may also develop the tissue stage of E. multilocularis as aberrant intermediate hosts. A taeniid egg is a warning, not a species identification. Match the test to the host and stage. For prevention, stop access to infected tissues and prey, reduce fecal contamination, and break the canid intermediate host bridge. Tiny adult, giant consequences. That is the Echinococcus lesson. Thanks for watching. I'm Christopher Lee, and what you know today protects everyone tomorrow.